This is an extract from the Leader Coronavirus Daily podcast by the Evening Standard and hosted by me, David Marsland. To hear the whole thing, search for it on your podcast provider. Non-EU migrant doctors and nurses are already exempt from a fee that charges lower-skilled health and care workers £400 for NHS services. Could it be scrapped for them all? It's actually supposed to be going up this year, but with so many workers from other countries playing vital roles in the UK's defence against coronavirus, leading Tory names are joining calls for the levy to be dumped.
I think it's monstrous that people who come from overseas to help and risk their lives, sometimes in really difficult circumstances, aren't treated properly. And I think there's a basic sense of fair play in this country, which I hope Mr Johnson will recognise.
Lord Patten, the former chair of the Conservative Party, on BBC Radio 5 Live, adding his voice to those saying the charge has to go. Several prominent backbenchers are also piling on the pressure, calling the fare rise mean-spirited and petty. Our editorial column says they're right.
Boris Johnson is Tory leader because he led a Brexit campaign that cunningly linked the public's fears about immigration with their affection for the NHS. But now these twin political objectives of being mean to foreigners and friendly to nurses have collided over a policy called the Immigration Health Surcharge. The charge was introduced in 2015 by David Cameron's government in a failed attempt to appease rather than confront the scaremongering about the supposed burden that new migrants were claimed to be making. But what was applauded by voters going to the polls before the coronavirus is out of step as the nation gathers on its doorsteps this evening to clap the contribution of essential workers. Many of those essential workers are, Britain has suddenly realised, migrants. It's time for Mr Johnson to execute a swift U-turn and exempt health and care staff from the immigration health charge before it gets politically too embarrassing.
Our political editor Joe Murphy is covering the story for the Evening Standard. Joe, let's start with what this charge actually is.
Well, the migrant charge came in 2015. It was an attempt to answer for the idea that migrants were using our health service without having paid enough towards it. Really, because I think over many decades, Tory governments had talked about cracking down on health tourism and had found it extremely difficult. And this was an attempt to square that circle. But what this current government has done is increased it. It's now £400, and it's going to increase it again in October to £624. That is a big increase of more than 50%. And the problem is that it's seen as unfair, and so unfair that there are already exemptions to doctors and nurses whose visas have been extended. And once you start making exemptions and drawing a line, people start asking, why is the line there when surely it ought to be here? And that's what's going to happen, I think, over the next few weeks.
And Keir Starmer brought it up in the Commons during the PMQs this week. But some of the Conservative Party's own backbenchers are now rebelling against this, aren't they?
I think Keir Starmer rather cleverly sort of dug his spade into an oil well of Tory nerves that they might be seen as unfair to the health working heroes, and a sense of unease about the charge that has been there for a long time. And this crisis, this pandemic, has brought that to pressure. So you've had this geyser-like eruption overnight against the fee. And I was ringing round MPs today, and I have to say, it was a bit like the old Brexit days. You were getting people who sounded extremely concerned, and several MPs, senior ones, very keen to make clear that they were sympathising with the NHS and the care home workers.
And Boris Johnson himself is in, I'd expect, quite a difficult position because, of course, he's been praising the migrant NHS workers who he said saved his life.
Very interesting today, David, which is I called Number 10 and I said, look, this story's taking off. What's the Prime Minister saying today? And I was referred back to what he said in the House of Commons yesterday. Now, I thought he was interesting in the Commons yesterday. He spoke seriously. He said he'd given it a great deal of thought and that he was minded to keep the charge because people need to be paying into the NHS. However, he got his figures wrong. He said it would cost 900 million, and that seems to be over the course of 4 years. It's about nearly 300 million a year, but that's for all workers, not just the health and care sectors. The thing about him not saying anything much today, and it suggests to me that they may be sitting back at Number 10 thinking, do we want to keep on defending this policy, or should we perhaps be thinking in terms of being quiet, keeping a low profile, see how the debate goes, and maybe in the future exercising a bloodless U-turn.
Search for the Leader Coronavirus Daily on any podcast provider to hear more from the podcast.